Hello, my name is Francois Debrant, and I'm a Senior Vice President at Signify Health. And we're here today to talk a little bit about how you can leverage the power of episodic care payment programs to really create and sustain high-value networks in your local geography, close to where your employees and their families work and live. And the key to all of this is really to tackle at the same time delivery system and payment reform. Now, we do this by generating a dynamic in the delivery system that is competition around value. And that starts by doing a series of analyses leveraging existing data sets, commonly publicly available information on how providers are delivering care. We get this from Medicare, we get this from the National Committee for Quality Assurance, we get this from Leapfrog that focuses on patient safety, and of course we use some of our own data sets to augment and supplement those publicly available metrics. Then we negotiate episodic care contracts with those providers, and we do this on a broad swath of conditions, procedures. It includes maternity, behavioral health, other conditions, overall episodes that can aggregate to more than 50% of your medical spend. And what that means is that you're really now going to start getting significantly greater value from your network for your employees and have a significant impact on your total plan spend. And we do that through fixed guaranteed prices with full warranties. And that's important because upfront, you know exactly how much you're going to spend on every single episode. Those episode prices are set at a point where it's actually lower than your historical average. So for any episode of care that's contracted, you're already saving money. But importantly, over time, you save even more because the episode prices are fixed for a period of time, and that means zero inflation. Now, when's the last time any program implemented across your benefit plan resulted in zero inflation on a significant portion of the medical spend? For most employers, never. So this represents a significant opportunity to have an impact in both improving the quality of care for employees and their dependents, but also very favorably impacting the stability and sustainability of your benefits. Importantly for your employees, you can also use this program almost as a buy-up, and we'll get into this as we discuss how we segment the network into different tiers and the potential for you to use different cost-sharing changes, steerage options as a means to really get the biggest bang out of this program. So we start with the broad network, and that's important because ultimately change in performance is not static. In fact, it becomes very dynamic when you set the conditions in the market that encourages competition around value. So we start by contracting with as much of the network as possible on as many episodes as possible. And then we identify within that broad network, as we just mentioned, a network of distinction. These are providers who have better than average quality of care and are providing that better than average quality of care at a lower than average market price for an episode. The best tier ends up by being centers of excellence. You're familiar with that concept, of course, and it is an important component of this entire market dynamic. Why? Because you want the broad network to have something to shoot for. And if all you have is a center of excellence, most of them won't be able to get there. But anyone in the broad network can improve their quality of care so that they can become better than average. They can also improve the way in which they're managing patients to lower the overall costs of episode and get below average. So in that broad network, everyone is constantly competing to become part of the network of distinction. And those who are in the network of distinction obviously have an opportunity to potentially become a center of excellence, But also, if they're not careful, if they don't continue to improve the value, the quality of the care that they're delivering, making sure that they're keeping their prices competitive, they can be overtaken by anyone else in the broad network. And your role as an employer in really augmenting this dynamic and making it as powerful as it can be is to pull steerage levers. And you can do that through a combination of transparency, cost sharing differentials for plan members who end up by going to providers in the network of distinction or centers of excellence. Or you can also think about how you create significantly greater cost sharing for employees who don't go to the network of distinction or centers of excellence. So in any steerage program, you either have an opportunity to do something that is positive, not punitive, or potentially punitive. Either way, the way, the manner in which you're going to maximize your return on this program is by having as many employees and dependents end up by going to providers who are in the network of distinction or designated as a center of excellence. So our role is really upfront, as I mentioned, to do a lot of analysis to end up by differentiating providers who are going to be in that network of distinction or providers who are going to qualify as a center of excellence. So we take publicly available data, we take historical claims data, and we bring all of these together to create a episode provider specific score. And what we found is that, unsurprisingly, some providers may be very good at some things and they may be not as good at others. And that's why it's important not just to designate a provider as being preferred, but really designating them as being preferred for the management of diabetes, the management of cardiac conditions, the management of substance use disorders, or the delivery of a baby, or the management of a patient who needs to have a complex procedure. But it's at that level of the procedure, the condition, the episode that you want to create that distinction. And then again, we don't forget the rest of the network, and our job is to make sure that as many providers as possible in that broad network are contracted for an all-inclusive price with a full warranty at a lower price point than what the employer is historically getting. And again, we do this on as many episodes as we have in our portfolio so that ultimately you can cover more than 50% of your medical spend. And importantly also, Signify really works hard to collaborate with your carrier and your TPA so that the experience for you as an employer, the experience for the employee ends up by being as frictionless as it can get. And that's very different in the approach than what others do in this space. But we believe that for these programs to be sustainable and to give you the greatest possible return, working collaboratively with the delivery system, with your carrier or third-party administrator is really the recipe for success.